Marcus Wellington had built his empire on precision. Every meeting scheduled to the minute, every decision calculated, every relationship transactional. At 38, he controlled a tech conglomerate worth $3 billion, owned penthouses in 5 cities, and hadn't taken a sick day in 12 years. But on a rainy Thursday evening in downtown Seattle, sitting across from a woman whose name he'd already forgotten, Marcus discovered that the human heart follows no business plan. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed because tomorrow I've saved something extra special for you. The chest pain started as a whisper during the appetizer course. The restaurant was Marcus's choice, naturally. Le Bernardin, Seattle. Expensive enough to impress, exclusive enough to maintain his image, and efficient enough to wrap up the evening by 9 if things went poorly. His assistant had arranged the blind date through some high-society matchmaking service that catered to what they called successful professionals seeking meaningful connections. Marcus preferred to think of it as quality control for his personal life. Rachel Morrison sat across from him, a marketing executive from Portland who spoke in carefully measured sentences about her yoga practice and her rescue dog. She was attractive in the conventional way his social circle expected. Blonde, well-dressed, appropriately accomplished, but not threatening to his status. The conversation followed the predictable script of first dates among Seattle's elite, travel destinations, favorite restaurants, carefully sanitized career highlights. Marcus found himself checking his Patek Philippe watch more frequently than usual. His chest felt tight, but he attributed it to the restrictive Italian suit he'd chosen for the evening. The restaurant's air conditioning seemed inadequate, and he loosened his tie slightly while Rachel discussed her recent promotion. The company culture has really shifted toward work-life balance, she was saying, cutting her Dover sole into precise pieces. I've been making sure to disconnect completely on weekends. No emails, no calls, it's been transformative. Marcus nodded politely while calculating the quarterly projections that needed his review before tomorrow's board meeting. His chest felt like someone was slowly tightening a vice around his ribs. He took a sip of wine, hoping the alcohol might ease the tension. That sounds refreshing, he managed, though the words felt hollow. His own weekends were indistinguishable from weekdays, a continuous stream of conference calls with international partners, strategy sessions, and networking events. The idea of disconnecting was as foreign to him as speaking Mandarin. The pain intensified suddenly, radiating down his left arm like electricity. Marcus gripped the edge of the table, his knuckles whitening against the crisp, white tablecloth. The restaurant seemed to tilt slightly, and the conversation around them became a distant murmur. "Are you all right?" Rachel's voice seemed to come from underwater. "You look pale." Marcus tried to speak but found himself gasping for air. The pain in his chest was no longer a whisper. It was screaming. His vision blurred, and he could feel sweat beading on his forehead despite the restaurant's cool temperature. The wine glass slipped from his fingers, shattering against his plate and sending red wine across the white tablecloth like blood. I need. The words wouldn't come. Marcus clutched his chest, feeling his heart hammering irregularly against his ribs. The restaurant spun around him, faces of other diners becoming indistinct shapes in his peripheral vision. Rachel was on her feet now, her voice sharp with panic. "Someone call 911! I think he's having a heart attack!" The words echoed strangely in Marcus's ears. Heart attack! Impossible! He was 38 years old. He had a personal trainer. He took executive physicals annually. His last EKG had been perfect. This was just stress. Just the pressure of the Morrison acquisition. Just the lack of sleep from the past month of 18-hour days. But his body was betraying the logic of his mind. The pain was crushing now, radiating up his neck and down both arms. His breathing became shallow and rapid, each inhale feeling insufficient. The restaurant's ambient lighting seemed to dim, and the sounds around him, Rachel's voice, the clatter of dishes, the murmur of concerned diners, began to fade. A server appeared at their table, young and flustered. "Sir, are you okay? Should I call a doctor?" Marcus tried to nod, but found himself sliding sideways in his chair. The last coherent thought he had before losing consciousness was how inconvenient this timing was. He had the Yamamoto meeting in the morning, and the quarterly reports were due to the board by Friday. The restaurant erupted into controlled chaos. Rachel stood frozen, her hands pressed to her mouth, watching as Marcus slumped forward onto the table. The server was already on his phone with emergency services, while the maitre d' rushed over with a first aid kit that suddenly seemed woefully inadequate. "He just collapsed," Rachel was saying to someone, though she wasn't sure who. "We were just talking, and then he grabbed his chest and—" Her voice trailed off as she watched Marcus's face, which had gone from pale to gray in a matter of seconds. Other diners had turned to stare, some standing up from their tables to get a better view of the drama unfolding. A few had their phones out, either calling for help or capturing the scene. In Seattle's social media-obsessed culture, even medical emergencies became content. "The ambulance is on the way," the server announced, though his voice carried little confidence. Thursday evening traffic in downtown Seattle was notoriously heavy, and Le Bernard was located in the heart of the business district, where emergency vehicles often struggled to navigate the narrow streets. Marcus's breathing had become labored and irregular. His expensive suit, which had fit him perfectly an hour earlier, now seemed to constrict around his chest and neck. His Hermes tie had twisted awkwardly to one side, and his usually perfect hair had fallen across his forehead, damp with perspiration. Rachel found herself stepping closer despite her instinct to flee. She had never witnessed a medical emergency before, and the reality of it was nothing like the sanitized versions she'd seen in movies. This was messy and frightening and utterly unpredictable. Marcus, this man she'd known for barely an hour, was possibly dying in front of her, and she felt completely helpless. The restaurant manager appeared, a thin man in his 50s, who looked like he'd rather be anywhere else. "The paramedics should be here in 10 minutes, he said, though he was clearly guessing. "Is there anything we can do in the meantime?" Nobody had an answer. The first aid kit contained Band-Aids and antiseptic wipes, nothing that seemed relevant to a heart attack. Rachel realized she was holding her breath, as if her own breathing might somehow affect Marcus's condition. Time seemed to move differently in crisis moments. What felt like hours was probably only minutes, but each second stretched endlessly as Marcus fought for consciousness. His face had taken on a grayish pallor that made Rachel think of old photographs, and his breathing sounded labored and wet. Then, cutting through the restaurant's tense atmosphere like a blade, came a voice that carried absolute authority. "Everyone step back. I'm a nurse." The crowd parted to reveal a young woman in scrubs, her dark hair pulled back in a practical ponytail, her hands already moving with practiced efficiency. She was small, maybe 5'4", but her presence immediately commanded the space around Marcus's table. Unlike everyone else in the restaurant, she didn't look panicked or uncertain. She looked focused. "How long has he been unconscious?" she asked, dropping to her knees beside Marcus's chair and immediately checking his pulse at his wrist, then his neck. "Maybe 2 minutes," Rachel managed. "He was complaining about chest pain, and then he just collapsed." The nurse nodded, her fingers still pressed against Marcus's neck. "His pulse is weak and irregular. We need to get him on the floor." She looked up at the server and restaurant manager. "Help me move him, but be gentle. Support his head and neck." Together they carefully lowered Marcus from his chair to the restaurant floor, which the manager had quickly cleared of table debris. The nurse immediately began checking his airway, tilting his head back slightly and listening to his breathing. "What's your name?" Rachel asked, surprised by her own need to know. "Elena Rodriguez," the nurse replied without looking up, her hands now moving across Marcus's chest, checking for responsiveness. "I just got off a 12-hour shift at Seattle General. Lucky timing, I guess." Lucky for Marcus, Rachel thought, watching as Elena worked with the kind of calm competence that only came from years of experience. Her scrubs were rumpled and slightly stained, evidence of the long shift she'd mentioned, but her movements were precise and confident. Elena's hands moved with surgical precision, unbuttoning Marcus's shirt to better assess his condition. His skin was clammy and cold to the touch, his breathing shallow and erratic. She pressed her ear to his chest, listening intently to the irregular rhythm of his heart. "Is he going to be okay?" Rachel whispered, her voice barely audible above the restaurant's hushed conversations. Elena ignored the question, focused entirely on her patient. She pulled a small penlight from her pocket, a habit from years of nursing, and checked Marcus's pupils. Both were dilated and sluggish to respond, not good signs. "Sir, can you hear me?" Elena spoke directly into Marcus's ear, her voice firm but calm. If you can hear me, try to squeeze my hand." His fingers twitched slightly, but there was no purposeful response. Elena frowned, checking his pulse again. It was growing weaker, more irregular. The paramedics needed to arrive soon, or this well-dressed businessman was going to die on the marble floor of an upscale restaurant. She turned to the restaurant manager, who was hovering nearby, wringing his hands. "Do you have any aspirin? Even children's aspirin would help." I don't know. Maybe in the office?" "Find out, now." Elena's tone brooked no argument. "And get me some ice water and clean towels." Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. As the manager scurried away, Elena began loosening Marcus's belt and removing his shoes, anything that might restrict circulation. His expensive Italian leather shoes were replaced by her practical concern for his survival. She noticed his watch, a Patek Philippe that probably cost more than she made in 6 months, and carefully removed it to check his pulse at the wrist. "What can I do?" Rachel asked, seeming to need a purpose in the unfolding crisis. "Keep people back, keep the area clear, and watch for the paramedics. Flag them down the moment you see them." Rachel nodded, grateful for something concrete to do. She positioned herself near the restaurant's front windows, scanning the street for any sign of emergency vehicles while Elena continued her assessment. Marcus's condition was deteriorating. His breathing had become more labored, and his skin was taking on a bluish tint around his lips and fingernails. Signs of oxygen deprivation that Elena recognized from countless emergency situations. She had maybe minutes before his heart stopped entirely. The restaurant manager returned with a small bottle of aspirin and a glass of ice water. Elena crushed 2 tablets between her fingers and tried to get Marcus to swallow them, but his swallowing reflex was too weak. She settled for placing the crushed aspirin under his tongue, hoping some would absorb into his bloodstream. "How do you know all this?" Rachel called over, still watching the street. 12 years in emergency medicine," Elena replied, now using the ice water to cool towels and place them on Marcus's forehead and wrists. "I started as a trauma nurse right out of school. You see enough heart attacks, you learn to recognize the signs." What she didn't mention was her own exhaustion. The 12-hour shift she'd just completed had been brutal. 3 car accident victims, 2 overdoses, and an elderly woman who'd coded twice before they managed to stabilize her. Elena had been looking forward to nothing more than a hot shower and 8 hours of sleep when she'd stopped at Le Bernardin to pick up a takeout order for her roommate. Now she was on her knees on a restaurant floor, fighting to keep a stranger alive with nothing but basic first aid supplies and her own experience. It wasn't the first time her off-duty hours had been interrupted by medical emergencies. Nurses developed a 6th sense for crisis situations, an inability to walk away when someone needed help. Marcus stirred slightly, his eyelids fluttering. Elena leaned closer, watching for any sign of returning consciousness. "That's it," she murmured. "Stay with me." "What's your name?" His lips moved almost imperceptibly. Elena had to strain to hear him. "Marcus," he whispered, the word barely audible. "Good, Marcus." "I'm Elena. You've had a heart attack, but help is coming. Just focus on breathing, okay? Nice and slow." Marcus's eyes opened briefly, unfocused and confused. He tried to sit up, but Elena gently pressed him back down. "Don't try to move. Your heart needs rest right now. The paramedics will be here soon." "Meeting," Marcus mumbled, his words slurred. "Board meeting. Tomorrow." Elena couldn't help but shake her head. Even in the middle of a cardiac event, this man was thinking about work. She'd seen it before. High-powered executives who treated their bodies like machines, pushing through warning signs until catastrophic failure. "The only meeting you need to worry about right now is with a cardiologist," she said firmly. "Everything else can wait." Outside, the wail of sirens finally cut through the Seattle evening. Rachel pressed her face to the window, watching as an ambulance navigated through the heavy traffic, its lights painting the buildings in alternating red and blue. "They're here," she called out. Elena felt a wave of relief. She'd done everything she could with limited resources, but Marcus needed advanced cardiac life support, medications she couldn't provide, equipment she didn't have access to. His pulse was still weak and irregular, his breathing labored. They were cutting it close. The paramedics burst through the restaurant doors with professional efficiency, wheeling in their equipment and quickly assessing the situation. Elena smoothly transitioned from primary caregiver to consulting nurse, briefing them on Marcus's condition and her interventions. 38-year-old male, sudden onset chest pain followed by loss of consciousness approximately 15 minutes ago, she reported crisply. Weak, irregular pulse, signs of cyanosis, responsive to voice but disoriented. I administered crushed aspirin sublingually about 8 minutes ago. The lead paramedic, a stocky man with graying hair, nodded approvingly. Good work. Are you medical? RN at Seattle General, just got off shift. Lucky timing. He was already attaching cardiac monitors to Marcus's chest while his partner prepared an IV. What's your read on him? Elena watched the monitor as Marcus's heart rhythm appeared on the screen. Irregular and concerning, but not the flat line she'd been fearing. STEMI, probably. He needs a cath lab fast. The paramedic agreed with her assessment. Saint elevation myocardial infarction, a massive heart attack caused by a complete blockage of one of the major arteries supplying blood to the heart muscle. Without immediate intervention to restore blood flow, the affected heart muscle would die. As the paramedics worked to stabilize Marcus for transport, Elena found herself stepping back, her role in the emergency suddenly secondary. It was always difficult to hand off a patient, especially one she'd fought to keep alive through the crucial first minutes of the crisis. Marcus was more alert now, the oxygen mask helping to clear some of the confusion from his eyes. He looked around the restaurant, taking in the concerned faces of strangers, the medical equipment surrounding him, the reality of his situation slowly penetrating through the cardiac medication the paramedics had administered. His gaze found Elena, standing nearby with her rumpled scrubs and tired eyes. Their eyes met for a moment, and she saw something she hadn't expected. Not just gratitude, but a kind of vulnerable recognition. This man, who had probably never needed anyone's help in his adult life, had just experienced the most fundamental human dependency, the need for another person to keep him alive. Thank you, he mouthed silently, the oxygen mask muffling his words. Elena nodded, unsure why this particular patient was affecting her more than usual. Maybe it was the contrast. This powerful businessman reduced to complete helplessness, dependent on her knowledge and quick thinking. Or maybe it was simply the exhaustion from her long shift making her more emotional than usual. We're ready to transport, the lead paramedic announced. Seattle General? Actually, his partner interjected, checking his tablet. Harborview has the cardiac team on standby tonight. Dr. Martinez is scrubbed in and ready. Elena knew Dr. Martinez by reputation, one of the best interventional cardiologists in the Pacific Northwest. Marcus was getting excellent care, better than he would have received at many hospitals. His wealth and status wouldn't matter in the cardiac catheterization lab, but his proximity to world-class medical care certainly would. As they wheeled Marcus toward the ambulance, Rachel approached Elena uncertainly. I should probably go with him, right? I mean, we came together. Elena studied the other woman's face. Rachel looked shaken, but not particularly invested in Marcus's welfare, more concerned with doing the socially appropriate thing than with genuine care for his condition. Are you family? Elena asked. No, This was actually our first date. Blind date, set up through friends. Elena nodded. The hospital will only give medical information to family members anyway. If you want to check on him later, you can call, but there's not much you can do right now. What Elena didn't say was that she was planning to follow the ambulance to Harborview herself. It wasn't unusual for off-duty medical personnel to check on patients they'd helped stabilize, especially in cases where their intervention had been critical. At least, that's what she told herself as she watched the ambulance pull away from the restaurant, its sirens fading into the Seattle night. Elena arrived at Harborview Medical Center 20 minutes after the ambulance, her Honda Civic looking out of place among the luxury cars in the emergency parking area. She told herself she was just checking on a patient, fulfilling her professional duty, but the truth was more complicated. Something about Marcus Wellington had gotten under her skin in a way that patients rarely did. The cardiac catheterization lab was already in full swing when she inquired at the nurse's station. Dr. Martinez had found a complete blockage in Marcus's left anterior descending artery, the vessel cardiologists grimly called the Widowmaker because of its tendency to cause fatal heart attacks. They'd successfully placed 2 stents and restored blood flow, but the next 24 hours would be critical. Are you family? the charge nurse asked, recognizing Elena's scrubs but not her face. "I'm the nurse who stabilized him at the scene, just wanted to follow up." The charge nurse, a veteran named Patricia, whom Elena had worked with during her ICU rotation years earlier, softened her expression. "He's lucky you were there. Dr. Martinez said another 10 minutes and we would have been looking at massive cardiac damage, if he'd survived at all." Elena absorbed this information quietly. She'd saved lives before. It was part of the job. But somehow this felt different. Maybe it was because she'd acted outside her usual clinical environment, without the safety net of hospital protocols and equipment. Or maybe it was the way Marcus had looked at her in those final moments before the paramedics took over. "Can I see him? Just for a minute?" Patricia checked her computer screen. "He's being moved to a cardiac ICU now, family only, but..." She glanced around and lowered her voice. "Room 314. 5 minutes. And I never saw you." Elena took the elevator to the 3rd floor, her exhaustion finally catching up with her. She'd been on her feet for nearly 16 hours straight, but adrenaline had kept her going through the emergency. Now, in the quiet hospital corridors, she felt every minute of those long hours. Room 314 was dimly lit, filled with the soft beeping of cardiac monitors and the whisper of mechanical ventilation. Marcus lay unconscious, looking smaller and more vulnerable than he had in the restaurant. The expensive suit was gone, replaced by a hospital gown. The confident businessman had been reduced to another patient in the ICU, distinguished only by the complexity of his monitoring equipment. Elena approached his bedside, checking his chart automatically. His vitals were stable but not strong. The next few days would determine whether he'd make a full recovery or face permanent cardiac damage. She noticed his personal effects on the bedside table: the Patek Philippe watch, his wallet, a smartphone that had been buzzing intermittently with missed calls and messages. "You saved his life." Elena turned to find Dr. Martinez standing in the doorway, still in his surgical scrubs. She'd never met him personally, but his reputation preceded him. Brilliant, demanding, with a success rate that had made him legendary among Seattle's medical community. "Just did what anyone would do," Elena replied automatically. "No," Dr. Martinez stepped into the room, his voice quiet but firm. "What you did in that restaurant, with no equipment, no backup, that was exceptional nursing. The aspirin you gave him probably prevented a second, larger clot from forming. Your cooling technique helped preserve brain function during the period of reduced circulation. You bought us the time we needed to save him." Elena felt a flush of professional pride, though she tried to downplay it. "I had good teachers. Seattle General is lucky to have you. Though I have to ask, what are you doing here at midnight after working a full shift?" It was a fair question, one Elena wasn't entirely sure how to answer. Professional curiosity, I guess. You invest that much effort in saving someone, you want to know how the story ends. Dr. Martinez studied her for a moment, then nodded toward Marcus. "Well, thanks to you, this story has a much better ending than it could have. He'll be unconscious for several more hours while the sedation wears off. But his prognosis is good. Full recovery is expected, though he'll need significant lifestyle changes." After Dr. Martinez left, Elena found herself alone with Marcus again. She should go home, shower, sleep, and prepare for another shift tomorrow. But something kept her in the chair beside his bed, watching the steady rhythm of his heart monitor, a rhythm she'd helped preserve. Around 3 in the morning, Marcus began to wake up. Elena watched as his eyes fluttered open, unfocused at first, then gradually taking in his surroundings. The breathing tube had been removed, but his voice was hoarse when he finally spoke. "Am I dead?" Elena smiled, despite her exhaustion. "Very much alive. You're in the cardiac ICU at Harborview. Do you remember what happened?" Marcus's memory seemed to return in fragments. The restaurant, chest pain. You were there." "I was there." He tried to sit up, then thought better of it as various monitors began beeping in protest. "How long have I been here?" "About 6 hours. You had a massive heart attack, but the surgeons were able to clear the blockage. You're going to be fine, but you need to rest." Marcus looked around the room, seeming to truly see it for the first time. "You're not supposed to be here, are you? I mean, you're not hospital staff." Elena hesitated. He was right. She had no official reason to be here, no professional obligation to a patient she'd never formally treated. "I wanted to make sure you were okay." "Why?" It was such a simple question, but Elena found herself without a simple answer. Why had she followed the ambulance? Why was she sitting beside the bed of a man she'd known for all of 20 minutes? Why did his recovery matter to her more than the dozens of other patients she'd helped over the years? I don't know, she finally admitted. Maybe because I've never had to fight that hard to keep someone alive outside of a hospital. Maybe because you looked so lost when you thanked me. Quote. Marcus was quiet for a long moment, studying her face in the dim light of the monitoring equipment. What's your name? I mean, I know you told me, but everything from tonight is a bit fuzzy. Elena Rodriguez. Elena. He repeated it carefully, as if committing it to memory. I owe you my life. You don't owe me anything. Any nurse would have done the same thing. No, Marcus said, his voice growing stronger. Any nurse might have known what to do, but not every nurse would have cared enough to follow through. Not every nurse would be sitting here at 3 a.m. making sure I was okay. Elena felt herself blushing, grateful for the dim lighting. You should sleep. Your body needs time to heal. Will you be here when I wake up? The question caught her off guard. There was something vulnerable in his voice. Something that went beyond the usual patient anxiety. This man who probably commanded boardrooms and made decisions worth millions of dollars was asking her, a nurse he'd just met, not to leave him alone. I have to work tomorrow. Today, actually. My shift starts at 7. Marcus nodded, trying to hide his disappointment. Of course. You have your own life, your own responsibilities. Elena stood to leave, then found herself hesitating at the door. But I could stop by tomorrow evening, after my shift, just to check on your progress. The smile that crossed Marcus's face was unlike anything Elena had seen in their brief acquaintance. Not the polished, professional expression he'd worn at the restaurant, but something genuine and grateful and entirely human. I'd like that, he said simply. As Elena finally made her way out of the hospital, she realized that saving Marcus Wellington's life had been the easy part. The complicated part was just beginning. Figuring out why a stranger's gratitude had touched something in her that years of professional nursing had never reached, and what it meant that she'd promised to return to his bedside not as his nurse, but as something else entirely. The Seattle dawn was breaking gray and misty over the hospital as Elena drove home, already counting the hours until she could return to room 314. For the first time in her 12-year nursing career, she was more interested in a patient's recovery than in her own rest. And for the first time in his 38 years, Marcus Wellington was learning that the most valuable things in life couldn't be scheduled, calculated, or controlled. They could only be received with gratitude from the hands of an angel who appeared when you needed her most. But their story was far from over. The next evening, Elena returned to find Marcus sitting up in bed, color restored to his cheeks and his business instincts already reasserting themselves. His smartphone lay beside him, and she could see he'd been fielding calls from his office, despite strict doctor's orders to rest. You're supposed to be recovering, not running a corporation from your hospital bed, Elena said, settling into the visitor's chair she'd occupied the night before. Marcus had the grace to look sheepish. My assistant called in a panic. Apparently the Morrison acquisition is falling apart without my direct involvement. And is that worth risking your life for? The question hung in the air between them. Marcus set down his phone, really looking at Elena for the first time since she'd arrived. She was out of her scrubs now, wearing jeans and a simple sweater that somehow made her look younger and more approachable than the professional nurse who'd saved his life. 3 days ago, I would have said yes without hesitation, Marcus admitted. Now, I'm not so sure. Elena pulled out a small wrapped package from her purse. I brought you something. Inside was a book, The Gifts of Imperfection by Brené Brown. Marcus examined it with the same attention he might give a quarterly report, reading the back cover twice before looking up at Elena with a puzzled expression. I don't typically read self-help books. I figured. That's exactly why you need to read this one. Elena's voice was gentle but firm. You nearly died because you've been treating your body like a machine that runs on nothing but ambition and caffeine. Maybe it's time to learn a different way. Marcus flipped through the pages, pausing at passages Elena had highlighted. Her handwriting filled the margins, notes and observations that revealed a thoughtful, introspective side he hadn't expected from their brief acquaintance. You've read this before. Several times. It helped me after my divorce 2 years ago. Sometimes we need to completely reconstruct how we think about success and happiness. Quote, this was the first personal detail Elena had shared about herself, And Marcus found himself intensely curious about this woman who'd entered his life so dramatically. "You were married?" To another nurse. "We worked different shifts, barely saw each other, grew apart gradually, and then suddenly." Elena's voice carried no bitterness, just acceptance. "We were both so focused on our careers that we forgot to focus on each other." Marcus saw an uncomfortable parallel to his own life. The relationships that had ended because of his work schedule, the friendships that had withered from neglect, the family members who'd stopped calling because he was never available. "Do you regret it? The divorce?" "I regret how it happened. I regret that we didn't fight harder for what we had. But I don't regret learning that there's more to life than just professional achievement." Elena leaned forward slightly. "What about you? Ever been married?" "Engaged once. 5 years ago." Marcus surprised himself by volunteering this information. "She said I was married to my company and she was tired of being the mistress." Was she right? Marcus considered this. Sarah had been beautiful, intelligent, from the right social circle, everything his lifestyle required in a partner. But when forced to choose between a crucial merger negotiation and her sister's wedding, he'd chosen the merger without hesitation. Completely right. I convinced myself that once I reached a certain level of success, I'd have time for relationships. But success just led to bigger challenges, more responsibilities. The goalposts kept moving. Elena nodded knowingly. The hedonic treadmill. You achieve what you think will make you happy, but the satisfaction is temporary, so you set bigger goals, achieve those, and still feel empty. You know a lot about psychology for a nurse. I majored in psychology before nursing school. Planned to be a therapist, actually, but my family needed the more immediate financial stability that nursing provided. Elena's expression softened with memory. My father was a construction worker who hurt his back when I was 20. Nursing meant I could start earning decent money quickly while still helping people. Marcus was struck by the contrast between their motivations. He'd built his empire primarily for personal achievement and financial gain. Elena had chosen her profession to serve others, sacrificing her original dreams for family obligation. Do you ever wonder what would have happened if you'd become a therapist instead? Sometimes, but I think everything happens for a reason. If I'd been a therapist, I wouldn't have been at that restaurant last night. Someone else would be wearing your expensive watch right now. The comment was delivered with Elena's characteristic directness, but Marcus heard the underlying message. Their meeting hadn't been a random coincidence. It had been necessary, meaningful in ways he was still trying to understand. Over the next hour, they talked with the kind of openness that usually took months to develop. Elena shared stories from her years in emergency medicine, the patients who'd touched her heart, the cases that had taught her resilience, the moments when her profession had felt like a calling rather than just a job. Marcus found himself describing aspects of his business philosophy he'd never articulated before, the loneliness of executive decision-making, the weight of responsibility for thousands of employees. You know what's strange? Marcus said as visiting hours drew to a close. I've had more meaningful conversations in this hospital room than I've had in boardrooms worth millions of dollars. That's because boardrooms are about transactions. This is about connection. Elena stood to leave, and Marcus felt the same inexplicable reluctance to see her go that he'd experienced the night before. But this time, it wasn't the fear of a cardiac patient left alone. It was something deeper, more complex. Elena, when I get out of here, would you? Marcus paused, realizing he was about to ask something that could fundamentally change both their lives. Would you have dinner with me? A real dinner, not as my nurse, not as someone checking on a patient, but as... What? Marcus met her eyes directly. As someone I'd very much like to know better. Elena's smile was answer enough, but she gave him words as well. I'd like that too, but Marcus? When we have that dinner, leave the phone at home. As Elena walked out of room 314 for the second time, Marcus realized that his heart attack had been both an ending and a beginning. The old Marcus Wellington, the one who measured worth in quarterly profits and stock prices, had nearly died on a restaurant floor. The man who remained was someone he was still getting to know, someone who was learning that the most important acquisitions couldn't be negotiated or leveraged. They could only be received as gifts from an angel in scrubs who appeared exactly when you needed her most, carrying not just medical expertise, but the possibility of a completely different kind of life. Up next, you've got 2 more standout stories right on your screen. If this one hits the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.